Hey everyone, and welcome back for another deep dive. Today we're going to be talking about something that's probably happened to you, and you probably wondered about those kind of weird white spots you get on your gums sometimes.
Yeah, it's interesting how often this comes up, and people aren't really thinking about the connection between their mouth and, like their overall health.
Totally. We think about brushing, flossing, that kind of thing, but not the bigger picture. So let's get into it. Based on what you've seen, what are some of the causes of these white spots?
Well, it really varies. It could be something super common and annoying, but not serious, like a canker sore.
Ugh, yeah, canker sores. We've all been there, right?
Mm.
Those little white or yellowish ulcers, ow. What causes those anyway? I feel like they just kind of pop up out of nowhere.
It really is a bit of a mystery, like the exact cause is still kind of unknown.
Hmm.
But there is some research that shows there's a connection to nutrition.
Really?
Yeah, they found a link between canker sores and low levels of certain B vitamins.
Huh. I never would have thought about that connection.
Yeah, especially B12, B6, and folate seem to be involved. Now, it's not like a direct, you're low in B vitamins, bam, canker sore, but having enough of these nutrients seems to be important for preventing them.
Wow, makes you think what other little signs our mouths are giving us about our health, huh?
For sure. It's all connected.
Okay, so canker sores are one thing.
Yeah.
But you also found some stuff about oral lichen planus. That sounds kind of intense. What is that?
Right. So unlike canker sores, which are like little round ulcers, oral lichen planus looks more like, I don't know how to describe it other than lacy.
Lacy, okay.
Yeah, lacy white patches, kind of like a web almost
Hmm.
on the inside of your mouth. And it can be totally painless or it can be really sensitive, especially to certain foods.
Oh man, that's got to be tough. But it's just in your mouth, right?
Well, the thing is, it's an autoimmune condition.
Oh, okay. So more than just a mouth thing then. What does that mean exactly for someone who's never even heard of this before?
Basically, it means that your immune system, which is supposed to be fighting off bad stuff, kind of gets confused and starts attacking the healthy tissue in your mouth.
So like your body is attacking itself.
Exactly. And here's the thing. It usually affects the mouth, but it can also show up other places in the body, like on the skin or the esophagus even, sometimes even the genitals.
Well, okay. So yeah, definitely not just a mouth thing. And is it treatable?
So there's no cure, unfortunately.
Yeah?
But the good news is that the symptoms are usually manageable
Okay, good to know.
with medications and some lifestyle changes. The important thing is that if you think this is what you've got, you get a proper diagnosis and talk to your doctor or dentist.
Knowledge is power, especially when it comes to advocating for yourself.
Right. You're actually more likely to notice these things early if you've already heard about them.
Exactly. Now, before we go on, I do want to address the elephant in the room. I was reading that there might be a link between oral lichen planus and oral cancer.
Yeah, that is something that comes up. And it's definitely worth mentioning.
So what do we know about that connection?
So for the vast majority of people with oral lichen planus, it's not going to develop into oral cancer, but there is a slightly higher risk. That's why getting diagnosed early and getting regular checkups is so important. That way you can stay on top of it and catch anything early.
So it's more about being aware of the potential risk.
Exactly, exactly. Okay, so we've covered canker sores and oral lichen planus, but what about oral thrush? I feel like most people have at least heard of that one.
Oh yeah, oral thrush.
Yeah.
I think people kind of have an idea of what that looks like. Not that it's a competition for worst looking mouth ailment or anything.
Oh, right. But yeah, it's also known as oral candidiasis, which sounds a lot more official, less like something you'd find in a refrigerator.
Cottage cheese mouth. Appetizing. Okay,
Uh-huh.
so what exactly is going on there?
Yeah, so as appetizing as that sounds, what's happening is that you get an overgrowth of a yeast. It's called candida.
Candida. Okay, I've heard of that.
And get this, candida is actually a normal resident of our mouths. And our digestive tracts, for that matter.
Wait, really? So we're all just walking around with this potential dot situation in our mouths?
Haha, in a way, yeah. But before everyone freaks out, it's important to remember that in small amounts, it's totally harmless. Our immune systems and the good bacteria in our bodies usually keep it in check. It's only when that balance gets thrown off that things get out of whack and you get that overgrowth, which is the oral thrush.
So what are some things that can cause that imbalance? Like what tips the scales in Candida's favor?
One of the biggest culprits is antibiotics.
Oh, that makes sense.
Yeah, antibiotics are great for killing off bad bacteria, which is what they're supposed to do, but they can also wipe out the good bacteria that keeps candida in check.
Oh, so it's like clearing the path for Candida to take over.
Exactly.
Yeah.
It's all about balance. And of course, if your immune system is weakened for whatever reason, that also makes it easier to get oral thrush. Some medications can do it too, like corticosteroids.
Huh. Interesting. So it really is all connected, your gut health, your immune system.
Yeah. Oh, and even something like dry mouth can make you more susceptible.
Wow, who knew? Dry mouth.
Mm.
So it really is the little things, huh? It's a good reminder that even when we're taking medicine to have one problem, there can be other effects.
Right. Like we were saying, it's all connected. Speaking of connected, there's another condition that can cause white spots on your gums, and this one is really important to be aware of: leukoplakia.
Leukoplakia. Leukoplakia. Okay, that one doesn't ring a bell. What is that? Is that like a canker sore?
Not really. It looks totally different. With leukoplakia, you get these like thick white or grayish patches.
Patches.
Yeah. And you usually find them on the gums, insides of the cheeks, tongue, that kind of thing.
And those are bad.
Well, they're not necessarily bad in and of themselves. BUT, the thing about leukoplakia is that it can be a sign of other things going on.
Uh-oh. Okay. Like what causes it?
So we don't know the exact cause, but there's a really strong link to tobacco use.
Really?
Yeah, any kind of tobacco. Cigarettes, cigars, chewing tobacco, that kind of thing.
Oh, wow. So not great.
Not great, no. And that's what makes these patches more than just a cosmetic thing, because we know tobacco is linked to all sorts of health problems.
Right. Right. So if you see these patches and you use tobacco,
Yeah.
that's definitely something to talk to your doctor about.
For sure. It's like your body waving a little red flag, like, hey, pay attention to this.
Okay, good analogy. Now, I did see something about there are different types of leukoplakia. Something about a speckled kind? What's that all about?
Yeah, so there's what's called basically regular leukoplakia, which is just the white patches. But then there's speckled leukoplakia, which is where you have white AND red areas.
Red, too. Uh-oh. What do the red areas mean?
Yeah, so those red areas can be a sign of precancerous changes. So that's definitely something you want to get checked out right away.
Okay, so if anyone's listening and they're like, wait a minute, do I have leukoplakia? What should they do?
First of all, don't panic.
Easier said than done sometimes.
True, true. But seriously, if you're concerned, just call your dentist.
Yeah, always a good idea to get things checked out.
Exactly. And I think this is a good place to bring up something I saw in your research, actually.
Oh, yeah.
Yeah, there was a quote from a dentist, Dr. Lilly, and they said, and I quote, "A biopsy is important for cases of leukoplakia."
Wow. Okay, so definitely not messing around. A biopsy sounds kind of serious.
It can be, but it's also the best way to figure out exactly what's going on and how to treat it.
So much better to know than to not know. Knowledge is power and all that.
100%. All right, so to sum up, white spots on your gums could be nothing, could be something. Pay attention, don't freak out, and call your dentist if you're concerned.
Excellent advice. So what can we do to prevent these things in the first place? Aside from, not smoking.
Right, of course. Well, there are actually a few things.
Okay, lay it on me. What else can we do?
All right, so besides not smoking, good oral hygiene is key, obviously.
Of course, got to brush and floss. That's a given. What else?
Right, but then also think about things that irritate your mouth.
Irritate your mouth. Like what?
Yeah, like spicy foods, acidic drinks,
Nah.
even like if you have dentures that don't quite fit right.
Oh, right. That makes sense.
All that stuff can cause little injuries that make it easier for things like candida to take hold.
Good point. So it's really about being aware of what you're putting in your mouth.
Exactly. And of course, there's diet.
Oh, right. We were talking about that earlier with the canker sores.
Yeah.
So eating healthy can help prevent all of this?
Pretty much. It all comes back to that balance in your mouth.
Yeah.
You gotta feed the good bacteria.
The microbiome, right. Everyone's talking about the microbiome these days.
It's important. But there's one more thing that I don't think we've mentioned yet.
Oh, really? What's that? Don't leave me hanging.
Stress.
Stress. What does stress have to do with white spots on my gums?
More than you might think. Stress weakens your immune system. And we've already talked about how important your immune system is for keeping everything in check.
True. So if you're stressed out, you're more likely to get sick in general, and that includes your mouth.
Exactly. So managing stress is actually really important for oral health, too. Who knew, right?
I'm telling you, it really is all connected.
It is. But back to diet for a second. You asked about specific foods earlier, right?
Oh, yeah. What should we be eating?
Crunchy fruits and vegetables are great, like apples, carrots, celery.
Because they're crunchy.
Well, yeah, they act like little scrub brushes on your teeth.
Uh-huh. Okay, that makes sense.
And dairy is good too, especially yogurt and cheese.
I knew yogurt was good for you.
Yeah, they're full of calcium and phosphate, which helps build strong tooth enamel.
Awesome. Well, this has been super interesting, I've got to say. I feel like I learned a lot.
Me too. It's amazing how much we take our oral health for granted, But it really is a window into our overall health.
100%. Well said. All right, everyone, that's it for today's deep dive. Hopefully you learned something new about those weird white spots we get on our gums. Remember, knowledge is power, and early detection is key. And in the meantime, go eat an apple.